In reports and record keeping, we are going to chart the results of the assessments and the treatment plan, as well as write reports, progress notes, and discharge summaries, as well as any other patient or client related data. Okay, the global criteria here, quite simply, is we want to prepare reports and relevant records integrating the available information to facilitate the continuum of care. We also want to chart any pertinent ongoing information pertaining to the client, and we want to utilize any of this relevant information that is in our written documents for client care. The reports and record keeping is really a vital part of the treatment process, and this is for many reasons, and it helps us in many ways. Firstly, we need to know that keeping records and progress reports and things like that ensures accountability, not only to our supervisors or to a facility if we work at one, but also to the clients, to their families, to any possible referral sources that you might be sending your client to later on, as well as any funding sources, whether government or private or otherwise. Also, it just ensures that we are safeguarded against being questioned about any of our practices, because we need to prove personal action with regards to the treatment process, so we can show that it's documented, that we have worked on particular areas, addressed certain issues, and that can be signed and sometimes even witnessed by other co-workers. Also, it helps our co-workers, as if you are the primary counselor to a patient in a facility, for example, and you are away and some kind of situation or issue arises, your co-workers or other counselors can have a look at the reports and the records that you have for the client and be able to have the relevant information that they need, as well as the supervisor, and enables the supervisor to provide feedback and have an overall view of what's going on for all of the counselors as well as the clients in the facility. It also helps us to document every incident that happens throughout. So the kinds of reports we're going to have is, first of all, a progress report, which is usually on a weekly basis, and that just shows that we're identifying and hopefully targeting and reaching goals and objectives each week. We want to take a look at what issues need to be addressed in the coming week, and taking into account problems or issues that they had in the previous week. On a monthly basis, we want to chart the overall progress of a patient as they move through the phases of treatment, for example, primary, secondary, and tertiary. Then, on the other hand as well, we also need to do a incident report if anything like that happens. If a patient was to have a suicide attempt or might have smuggled some substances into the facility and used, or maybe even ran away and are refusing hospital treatment, anything like that also needs to be documented. And then right through until the end, once we've completed the treatment plan and they've gone through everything that they or achieved all the objectives in treatment or the program necessary, we're then going to do discharge planning. So then planning what the client will be doing once they leave treatment, or any kind of aftercare or self-help groups, or any other kind of referrals they're going to go through, and then we'll have a discharge report that is signed on the client's leaving. And then lastly, records also need to have sometimes the appropriate releases of information. So if we discussed before, when we are giving any information over to a referral source or to a family member or otherwise, we need to have that written consent, and that would also go into the client's file. So all of this documentation, right through from screening information, our intake information, all our assessment information, the treatment plan, case management, incident reports, progress reports, discharge planning, everything needs to be in the patient's file, so that if, say for example, also you have any issues arise later on, or legal issues or any kinds of problems like that, you have all the relevant information documented. And also, if say for example you are referring the client to a psychologist or a psychiatrist, then you need the progress information as well as the presenting problems and issues that they have and any previous problems that they have. You also have all of this in writing to be able to send to your referral source. Just a note before we move on, although this is not the primary purpose of reports and record keeping, one of the added benefits is that it demonstrates that the counselor is adhering to their ethical responsibilities and their legal responsibilities. And if we take a look at the Universal Code of Ethics that we should be following as counselors, there are 5 of those principles that accurate record keeping will show or demonstrate that we are adhering to. The first of those is Principle 2, which is responsibility, then Principle 3, which is competence, Principle 4, which is our legal and moral standards, Principle 7, which is client welfare, and Principle 8, which is confidentiality. And if you look at Principle 2, responsibility, by showing through reports and documentation everything that we've done throughout the treatment process, we show that we have been responsible. We show that we have paid attention to what the client has been telling us, any problems or issues that have arisen for them, that we've made an effort to resolve any problems and achieve the identified goals and objectives. It also shows our competence in Principle 3. Because if the reports are showing that we are doing what we say we're going to do when we say we're going to do it, that we are reliable and that we achieve the goals in a timely manner, then we are also demonstrating that we have been competent throughout the treatment process. If you look at Principle 7, which is client welfare, it also shows that we are holding the client's welfare in the highest regard. And then coming from a legal standpoint, if you look at Principle 4, legal and moral standards, it also shows that we have stuck to the laws and regulations of either our country or government, as well as our agency that we work for. And then lastly, Principle 8, confidentiality. As we know, if we have all the written release of information forms signed and documented, that we have adhered to that principle. Okay, just to run through the tasks for reports and record keeping. Documentation of the client's goals and the achievement thereof is important to both the client and the counselor. It's important to the clients because the client needs to be able to see that they're making progress and they're making inroads into their behaviors and their beliefs and attitudes. And this motivates them to want to continue on because they feel like they're gaining something from the counseling experience. It also gives them a sense of accomplishment and achievement and satisfaction. It helps the counselor because we need a reference point. We need to be able to look back through our reports and our records and be able to ensure that we're making good progress and we're achieving our set goals and objectives. But it also sometimes helps us to find patterns or problems or issues that we might not have noticed in our one-on-one counseling sessions when looking back. It also helps us to achieve our treatment plan and sometimes identify areas where our treatment plan might need alteration or adaptation to suit the client's current or future needs. And then next, documentation is critical for maintaining clear communication between the clinical staff team. If you work in a facility, the staff team need to be updated, which can be done through reports, but can also be done in staff meetings, because the staff team need to know the background and the progress of your client in case you're not available, or if you're away for the day or on leave, or if, say, a counselor is facilitating a group and you're not present in that group. If they're aware of your clients and their history and their problems and issues, they will be more capable of being able to deal with them. The next thing is also that a staff team, if you have a group of counselors working together, they share a broader range of knowledge and experience. And so sometimes consultation is wise, and we can sometimes find a problem to a solution that we might be struggling with by relying on assistance from our peers. Now, reports can also be useful to others who are working with the client. That would be referral sources and so on, or possibly correctional services or physicians, psychologists, psychiatrists. But we have to bear in mind here that you cannot pass any information across without informed consent from the client. But if, say, for example, you refer to a psychiatrist and they have no background information on the client, then they're pretty much starting from scratch. Whereas if they have the reports and the documentation from your screening and your assessment and so on, they'll have a much better idea of the client's history and how they ought to proceed with them. Then funding and licensing agencies will pay close attention to reports and record keeping. They might even have their own particular requirements in their reports and record keeping. So in this, the funding agencies, a good example would be medical aids. Medical aids might require a DSM form. They might require a weekly progress report for funding. Employer, for example, might want a weekly progress report to ensure that the staff member is committed and motivated towards their recovery in order to keep their job or position. And then licensing agencies, a good example there would be if you're a treatment facility and you are applying for registration or renewing registration, the department will probably check all of your records, and failure to have your records and that's everything from registers to weekly progress reports to your screening reports, your intake reports, everything. If that is not up to date, that can result in you losing registration or not gaining registration. And lastly, the clinical supervisor should regularly review all of the client's records and provide feedback to the counselor regarding content or format. The clinical supervisor should be checking all counselors' documentation on a regular basis, and the clinical supervisor will usually countersign all of the progress reports, discharge reports, incident reports, and so on to ensure that everything is being done according to policies and procedures of the facility. Okay, so all the typical forms we're going to use, we've already covered the first few in the previous core functions, but first of all we have intake, so the forms we're going to fill out when the patient or client comes into the program or into treatment. The assessment, which is our identifying their strengths and weaknesses and problems that need resolution. That going into our treatment plan, which is where we set our goals and objectives and our immediate and long-term goals especially. And then the treatment plan reviews is going to be our report, which is really reporting on the progress of achieving that treatment plan. Now the ones we really want to look at is the progress notes, the discharge plan, and the discharge summary. Okay, so with the progress reports or progress notes, we want to try and do this on a weekly basis, is what's suggested. And if we take a look at the things we need to bear in mind here, first of all, it is a part of the client's record or file. So we usually have a folder or file for every client, and in that folder we will keep all documentation from the intake, screening information, any reports we have from outside sources, as well as then obviously our treatment plan. So when we fill out our weekly progress report, we will then have that checked and signed, not just by us, but by our clinical supervisor, and then we attach it to that folder. We want to document the implementation of the treatment plan. So obviously once we've set our treatment plan, our goals and objectives, our progress report is really looking at how well we're doing at achieving those goals and how well we're implementing that plan, and that'll serve as the basis of the plan review, because that's what we're reviewing. Document all treatment delivered to the client, so not just the treatment we're providing, but any outside treatment. So for example, they're being treated for diabetes or for example liver damage or liver function problems or HIV/AIDS. So anything outside of what we're giving them we also document. That could also refer to their detox program. Then we want to describe the client's response to treatment. So their overall attitude and motivation and so on, their change in condition, as well as the overall outcome of treatment, and then any achievement of goals during that week. Then we want to include written reports from outside service providers. So if they go to a GP or a doctor, we want to include any reports they give us or any test results they give us. If they go to a psychiatrist or a psychologist, any feedback they give us in a report form, we'll attach that also. And then if we take a look at, we have a simple sample of a weekly progress report that you can use, and we'll just run through it quickly. You can change it and adapt it to your own program. So I'll pull that up on the screen, and if we look there, it just starts with the client name and primary counselor as well as the date. Then we look at client motivation and attitude, so we just monitor weekly what their motivation is. Are they positive and enthusiastic about the program? Are they showing commitment, or are they defiant and not really responding very well and showing negativity and maybe saying that they don't want to be there anymore, and so on. Then detox progress, if they're on detox, how far are they in detox, how are they progressing there, are they on medication, what medication are they still on, as well as their physical condition, because most addicts who come into treatment or will be in a very poor physical condition, so using diets, nutrition, and then obviously any treatment by a physician, we want to monitor how they improve physically. And then also psychologically and cognitive functioning, how are they adapting to treatment, are they able to function in groups, is their functioning sufficient to be able to adapt to the program. Some clients who come into treatment are still very hazy, might even still be in a drug-induced psychosis, so we want to monitor that on a weekly basis. And then overall progress, so just how they're progressing in their treatment program, any problems or issues that arose during the week, maybe an issue with another client or member of the facility, that kind of stuff. We want to put detail in there. And then issues to address, so if any issues did arise, what do we need to address by the next week? And then any additional goals and objectives that we identify and set for the next week. And then overall program progress, so depending on what stage of the program they're at, just tracking their overall treatment plan and how far they are. And then lastly, just any notes or comments that you might want to make, so that next week when you look back at this progress report, it gives you just a brief summary of what you need to take into account when you do the next progress report. And then that is signed at the bottom by the counselor and the clinical supervisor. So you can use this and adapt it to suit your own needs. Okay, the discharge planning is done at the end of the treatment program, and this is where the client is about to leave, and we want to make all the necessary preparations so that they have some kind of structure in place and know what to expect. So we want to start exploring things like where they're going to live, how they're going to support themselves, do they have a job, where they're going to look for work, are they going to attend self-help groups, and where are those groups, are they going to continue in some form of outpatient counseling. So we need to take all of that into account, and the first thing is that it will be developed by the client and the counselor. We'll sit down together and discuss all of these, as well as any short, medium and long-term goals. We'll put this down in writing, and that will be signed by the client and the counselor. This becomes a permanent part of the client's record, and this can be shared with outside sources even after discharge. And then the specifics that we might include, and we're going to take a look at a sample that we've attached for you again, but the specifics would include where the client might live after discharge, and if they have accommodation, whether or not the client will receive any outpatient counseling, whether or not they will attend any self-help groups, how the client will obtain work or go back to school, a financial plan for self-support, if any, if they do have some form of income, to work out how they're going to pay off any debts or any other problems that they have. And then lastly, just recommendations for continuation of any medication that they might be on, whether for any health or physical problems or addiction related, so prescriptions like anti-abuse, methadone and so on. So if we pull up our sample that we've given you, and pull that up onto the screen, you will see their discharge planning, and it lists the AA and NA meetings or aftercare, which venue and how many times a week they're going to be attending those. Agree for contact with a sponsor or counselor, how, where and when, and how many times a week. And then working on a daily recovery program, what are they going to do on a daily basis, any relaxation or meditation, how and when. Reading recovery literature and what kind of literature and when. contact with recovering friends and who and when, creativity, hobbies and pastimes because we need balance, what, physical exercise, what and when, any things we want to do for fun, any plans we have there and when, what are our plans for work or training or education, and where, when and how we're going to achieve those, how will you support yourself financially, what hobbies or pastimes are you interested in pursuing, in what ways will you nurture and express your creativity, what feelings, situations, people, places, etc. are dangerous for you, what kind of triggers, in what constructive ways can you deal with these. And then lastly, to list 3 specific people on whom you can depend for support. So that can be a counselor, a sponsor, or otherwise. And then just our short-term goals for the first week and long-term goals for the next 3 weeks. And then that is signed and agreed upon. Okay, last is the discharge report or summary, and this is usually completed and added to the client's record about within 15 days after they have been discharged. It should include or can include some summaries of the following, which is our significant findings, the achievement of all our goals, the course treatment, as well as the final assessment, recommendation for any further treatment, and then the written aftercare plan based on the client's needs as assessed, and then also developed by the counselor with input from the client and their family. Now we have a little sample of one, and I'll pull that up onto the screen. And if you take a look there, we have the client's name, primary counselor and date, the admission date and discharge date, and then the overall summary of what our treatment plan was and whether it's completed and any notes, and then a brief history of the client before coming into treatment, and then the summary of the treatment plan and progress in treatment, so how we've implemented that program and the results thereof, the reason for release, whether it's because they've completed program or they might have refused hospital treatment or otherwise, breaking of rules and so on. And then relapse prevention plan is the plan formulated with the clients and their family on what they're going to be doing after they leave treatment. So self-help groups, coming to aftercare support, contact with counselor and so on. In other words, the discharge report is a summary of everything we've taken out of the discharge planning and then the achievement of the treatment plan. Consultation with other professionals. This is in regard to client treatment and services, and this is relating to in-house staff as well as outside professionals to ensure a comprehensive quality care for the client. Okay, the global criteria here is we want to recognize the issues that are beyond the counselor's base of knowledge or skill. We also want to consult with other resources to ensure the provision of effective treatment services. Then we want to adhere to the applicable laws, regulations, and agency policies relating to disclosure of the client's identification or information. And then lastly, we want to explain the rationale of the consultation to the clients if appropriate. Consultation is quite important, and simply what it is where we are able to discuss our cases or our clients or any problems or issues that arise with our peers or other professionals or outside resources to gain better understanding or insights, or to get some guidance on issues that we're not really sure how to deal with. Because one of our biggest ethical responsibilities as counselors is that we need to know and recognize our limitations and never go beyond our capabilities when it comes to our particular knowledge, training and experience. So the most common form of consultation is when the staff team will sit down, usually on a daily basis or a weekly basis, to discuss and review their client cases. And in this they can gain a broader perspective on some of the problems and issues, as well as be able to get guidance from the supervisor or the more senior members of the staff team. Now this can also be done on an individual basis with either your clinical supervisor or another counselor or outside resources like a physician, a psychologist or a legal representative and so on. Consultation with other professionals is a huge benefit to the counseling process. We need to remember that addiction affects so many different areas of the addict's life. It's never really going to be possible or realistic that one counselor is going to be able to be proficient in addressing all of them. So we need to benefit from the additional experience, knowledge, and education of other professionals in the field, as well as gain additional insights, input, and information from other professionals to help us deal with the problems that the addict is facing in their treatment or recovery. Okay, just to end off with the tasks of consultation is, first of all, we need to know the reason for seeking consultation. We need to decide who's going to be the best person we can talk to. We also need to obtain the necessary release of information to protect confidentiality. Then we need to think about the desired result of the consultation. We need to think about how we're going to utilize the information obtained. And then lastly, we want to document the consultation.